It is estimated that more than 1 million people died every year due to drug-resistant bacteria. This happens when bacteria develops the ability to defeat the drugs designed to kill them and continue to grow until it kills the infected person. Resistant infections can be difficult and sometimes impossible to treat. It is considered by the World Health Organization as one of the biggest threats to global health, food security, and development today. This issue is increasing globally, and the death toll is just rising. It can affect anyone of any age in any country. There are many causes for this. 1. Widespread misuse of antibiotics, which reduce the effectiveness over time. 2. Lack of tools for rapid screening, aiding physicians choose the best possible treatment based on data. 3. Unclear protocols for alternative treatments. We want to tackle this problem by providing better tools and reimagining the lab of the future, starting with computational biology and moving towards synthetic biology and personalized medicine. We propose an end-to-end service with the ability to perform diagnostics and prediction using in silico models. This will have an impact reducing decision time and providing data-based care, thus avoiding the common practice known as empiric antibiotic therapy, which is the administration of broad-spectrum antibiotics prior to having confirmatory bacterial results, often leading to adverse patient outcomes. We envision a service called Synthetic RAM Lab, a service that will introduce automation with artificial intelligence and synthetic alternatives. It includes rapid confirmatory bacterial simulations, predictive bacterial infections, and therapy suggestions. For cases where antibiotics are not a viable solution, an alternative pathway can be offered, such as synthetic bacteriophage therapy, which are viruses that specifically infect bacteria and have long been considered as natural antimicrobial agents for treatment of bacterial infections. A service able to do this will have the following instances. First, identifying a matching alternative of synthetic therapy in a data bank. Second, in silico simulation for testing effectiveness. Third, pipeline for genome assembly. Fourth, and finally, cocktail preparation, dose finding and delivery estimates. We feel the world and technology is ready to take this journey, in contrast to the current landscape, which is population-centered, meaning most treatments and medications are made for the general population, generating massive adverse events and widespread misuse. Personalized medicine solves this because a tailored experience is now possible, from attention to treatment. Currently, most of the drive for personalized medicine came from cancer research, and we believe that the future of medicine is moving towards this. We ought to be prepared and trained to face future health challenges. This is Synthetic RAM Lab. The future of health is in you. Personalized.